So lying on the floor. Today we're going to start with just a scan, which is also a part of most of the Feldenkrais lessons. I'm kind of breaking it into two parts, the scan first, and then the Feldenkrais part. So I want you to imagine that you're lying on your favorite warm beach, and the sand is warm and soft. And I want you to really pay attention to the imprint that your body is making on the sand. Feel the back of your head and just notice, if you were lying on sand, how far back, how far into the sand would your head make a pressure point? You can even imagine lifting your head and turning around and looking back and seeing the imprint in the sand. And then scan to the back of your shoulders, shoulder blades, and just sort of notice. Our first instinct is just to kind of say, yep, there's some pressure. And then really go back and forth from the right side to the left side. Maybe one shoulder blade presses a little harder, sinks a little further into the sand. And there might be, if you really pay attention, there might be kind of the diffuse pressure across each shoulder blade. But you might even notice that there's a point where the most pressure is. There's the place where most of the pressure is, and then there's a little less pressure, and as you go out from the center of that highest pressure point on each shoulder blade, how it shifts and changes. And you can even notice, is it symmetrical? Is that point of highest pressure behind the right shoulder blade exactly the same as the left shoulder blade? And I'll say right now, not very likely. So the mind, especially if you're new to this, is going to really look for and possibly even imagine a lot of symmetrical pressure. But what's true is, we're all have one dominant hand, our right hand or our left hand, and we have a dominant leg, our right leg or our left leg. We even have a dominant eye. And we have all kinds of asymmetries within ourselves from that, which are perfectly natural and normal. And so some of what we're doing is just learning to listen to those pressures and asymmetries and just allow for those differences. Viva les différences. And just noticing the pressure right along the middle of the spine, in between the shoulder blades. And then those lower ribs, just beneath the shoulder blades. Again, listening to the right side and the left side. You may even start to feel like one side of your body, the whole left side or the whole right side, sinks a little more into the sand. If you could just rise up, if somebody tied some nice soft straps around you and lifted you straight up out of the sand and you could look back down, you might see those asymmetries in the imprint that you've left. And then following with your attention down to your lower back. And for most of us, our lower back begins to arch away from the floor or the sand a little bit. So you might notice a little less pressure, or for some of you, no pressure. And again, really noticing as if you're lying in the sand. Does the sand come up and meet your low back? Would there actually be a place of nothing touching the sand at all compared to those lower ribs? And then we'll follow with your attention down to the back of the pelvis, The center of the pelvis being the sacrum, and just feeling is that pressure symmetrical right there in the middle. And then as you fan out from the sacrum to the crest of the pelvis, the iliac crests. Some of you have been told you have SI problems. That's where your sacrum and your ilium meet, SI. So the sacrum's in the middle, the triangle bone. And sometimes when we say we put our hands on our waists, we're really kind of resting them on that bone, that iliac crest there. Feeling from right to left. And then following down. If your knees are bent, that's fine. Just kind of notice the pressure down to your feet. And if you're able to lie with your legs long, you can notice the backs of the buttocks and the thighs, the right and the left. Noticing what part of your thigh is lying against the sand. Is it right at the very back part, or do your legs roll outward a little bit? So it's a little bit on that outside part maybe. And you might even notice that one leg tends to roll a little more out or in than the other leg. And then again, noticing under your knees. For many of us, there's really no pressure under our knees. Might be a little different from left to right. You might sense a little more or less space under one knee. And the calves again. Noticing just where is the pressure from the right calf to the left calf. On down to the heels. Sometimes it's a little easier to tell how there's more pressure under one heel or foot than the other one. You might go back up and check the pressure underneath your arms and elbows. Again, just appreciating any differences, noticing your own unique imprint in the sand. And so sometimes just lying or sitting, this can easily be done in sitting. When the mind is getting busy and you're starting to notice that your pain is getting your attention more and more, just taking a break and saying to yourself these things, feeling the back of your shoulders, feeling your low back, your pelvis, just dropping into your body. Because as I have said many times to my clients, when we're hurting, we sort of mentally escape our bodies, and then we push them to do things they'd rather not do, and then we tend to pay for it later. Yeah? So this is a coming into our bodies, which isn't always the most comfortable thing if you've become very skilled at not staying present to the whole of your physical self, not just the pain, but the whole of you. And we can widen the perspective. We can get the brain to not just pay attention to the pain. I saw this funny quote at a conference Saturday: "The reign of pain lies mainly in the brain." So we also want the brain to be able to attend to the whole of you. And for many of you, I know, that there are many more places without pain than with pain. But the tantruming 2-year-old of pain is what gets our attention, yes? Okay.